Welcome viewers. I am Dr. J.P. Das, Director of Moshumi Hospital and the Principal of National Institute of Medical Science. Today I brought a ultrasound class of urinary bladder. How to do sonography of urinary bladder, what are the pathologies of urinary bladder, how to visualize them, what would be the associated factors. All those things I discussed in brief. So please see the video in detail. It will be very much beneficial for you, for doctors, paramedical staffs, also the common people. Please visualize this thing. So without delay, I am starting the video. Today we shall discuss about the ultrasound of urinary bladder. How to do ultrasound of urinary bladder. What are the findings, how to do preparations, general common findings of the urinary bladder. All those we are going to discuss. One thing you have to remember, that is the size, shape and of the urinary bladder cannot be seen properly if you cannot distend this thing. Urinary bladder should be distended. After distension only, you can see the size and shape of urinary bladder. It may be with the fluid, maybe with the urine. Bladder stones are highly echogenic. So you can visualize the stone very nicely, and there should be posterior shadowing of the urinary stone. Now come to the scanning technique. I said it, again I am saying, urinary bladder should be full at the time of visualizing. If the patient can take oral fluid, it's okay. If patient cannot take the oral fluid, you can push fluids like saline through the urethra, or you can give intravenous saline. It will go automatically to the urinary bladder. At least 500 to 600 ml of fluid should be there. And supine position should be there. It is the supine position. So supine position should be there. If there is over depression or over distended, distension should be normal for 500 to 600 ml. If it is over distended, then it will create trouble again. It will suppress the prostate downward, and there will be improper visualization of other organs like ovary, right iliac fossa and appendix. All these things you cannot visualize properly. And the bladder distension also very important for some other reasons also there. It is if the small bowel loops, it removes the small bowel loops. It will not come in between this, from pelvic cavity to the abdominal cavity. So proper visualization of the pelvic organs without distending the urinary bladder, it is not possible. Bladder feeding also do a ultrasound window, and there is better visualization of the pelvic organs. Distension is again required for detection of the pathology of bladder itself. Without distending the bladder, you cannot see the pathology. Now come to the cystitis. Cystitis, the infection of the urinary bladder. It is more common in females because their urethra is small and male urethra is long. So, and also it is easier for the infections, that is bacteria, to enter in the female genitalia. What you will get, see this picture here, you what you see, there is thickening of the urinary bladder. Urinary bladder is very thick, bladder wall. The urinary bladder may become small and atrophied due to infection. What you see in this picture, here is echogenic something you are seeing here, and behind this is the shadow. This is very important. This is urinary bladder stone. You can see very nicely without any confusion. You can detect the stone in the urinary bladder. It would be mobile. If you shift the patient rightward or leftward, the stone also will move. By this you can confirm it is a stone. And you can, by this you can differentiate this with the polyps and other pathology of urinary bladder. See this picture. What is this? Something arising from the urinary bladder wall, from the transition of epithelium, something projecting inside the urinary bladder. As the mass is projecting into the lumen, it is irregular in shape and appears, it may be pedunculated or non-pedunculated. Now, what you see here, some echogenic thing you can see here. It is mixed echogenic. See, the peripheral part is very much echogenic and inner part is less echogenic. In early hematoma, it would be very much echogenic. And with the course of time, the echogenicity will go down. With the course of time, the blood would be changed. It will be clotted. And there will be change of the organic molecules inside the blood. There will be it will change. Rotting will be there. So the echogenicity will decrease gradually. It may be associated with the fever because of infection. There may be blood loss with the micturition, and there may be infection. What you see in this picture, you see here is one pouch, here also urinary bladder. There is a connecting canals. Urine filled out the pouching of the bladder are easily recognized in common male, and it is common in male, especially in pulmonary tuberculosis patient and benign prostate hypertrophy. Cystic structure with the communication with the bladder lumen. It is called diverticula. Diverticula will not be empty. It would be urine filled. When the patient will void, the bladder would be empty, but diverticula would not be empty. Diverticula will remain urine filled. By this you can do the diagnosis. So post-voyage scan you have to do. Sometimes you can see the stone also inside the diverticula, and maybe the stone may be the cause of persistent infection. Diverticulata also can harbor infection. It is the last picture. In this picture, you see there is a snake-like something protruding from the wall of the urinary bladder. This is called ureterocele. It is due to stenosis of the urethra. It is due to stenosis of the ureter at the terminal end of the ureter, with intrusion of ureter into the urinary bladder. Here, urinary bladder intruded inside the urinary bladder. And there would be sharp ureteric jet, which are seen protruding and bulge, mimicking the snake head. Looks like a snake head. It is common in female, and in 10% cases, it is bilateral. Bilateral means two ureter is there. One would be inside this side, another would be in this side. And there may be hydronephrosis. That was, there will be backward pressure over the kidney, so there may be accumulation of fluid inside the kidney. So friends, we have come in the end of this video. I hope you have understood and learned how to visualize the urinary bladder and different common pathology of urinary bladder, how to see it, how to look it, how to diagnose this thing. Friends, we have come at the end of this video. Hope you have liked this. If you have liked this, give a like. If you if you are new in this channel, please subscribe this thing and push the bell button so that I can bring new videos for you, this type of informative video. If you want to take admission in ultrasound classes of National Institute of Medical Science, I myself teach you how to do ultrasound of different organs in details. Please ring me in the following number, and number which is displayed downside. So see you again in the next video. Until then, bye bye.